Hello, and welcome to Consider This, where thoughts and conversations come together. My name is Barry Wright, and I'm the director of the Niagara Community Observatory, and today here at Brock University, and today we're going to be discussing concussions. And these are head injuries that affect how the brain functions. Concussions just don't happen to professional athletes, as our guests will talk to us about. They're particularly common among children and youth. And according to the Niagara region's statistics here in our area, most emergency room visits for concussions are in the young category from 10 to 19 years of age. Since the beginning of this year, school boards are now required to have a policy in place in dealing with concussions and encouraging sports club and other organizations to adopt similar policies. Joining us to explore concussions today on my immediate right is Dr. Don Good from the psychology department here at Brock University, and on my far right is we have Dr. Kathy Swayze. Dr. Kathy Swayze is a medical doctor and a fellow at the College of Family Physicians of Canada, and is a member of the Canadian Academy of Sports Medicine, and also works with Ridley College on their concussion team. So thank you for joining us both today. Let's get started, and perhaps maybe Dawn, I can ask you first if you can talk a little bit about your programs and your interest in concussions here through your research.
Sure. We work in our lab looking at the social and emotional barriers to community reintegration in individuals who have had neurological compromise, and that includes, perhaps surprisingly, individuals who are living with concussion and mild brain injury and mild head injury. Although we look at individuals and examine individuals with severe injuries, we actually also look at individuals who are asymptomatic. That is, they don't have any complaints of a head injury, but they have a history of significant alteration of consciousness due to some kind of typically head impact in their history. And we examine their possible cognitive changes, possible emotional changes, possible social integration changes as a function of their injury. And we look at it in most of our folks, we find out after the fact that they've had a head injury from maybe a motor vehicle collision, maybe a fall, but most of them will be from sports injuries.
Great. Thank you, Dawn. Kathy, how did you get interested in this area?
Well, I used to do sport medicine full time, then got back into family medicine. I was the medical director at Ridley College for many years and saw all their sports injuries and concussions. And then as my interest grew because of what we were seeing, we formed a team there to work as a comprehensive team for learning as well as injury recovery and return to sports. So we were doing kind of the return to learn and the return to play before kind of it became popular these last few years. So as it becomes more and more in the community, I've just become more and more involved, and as we know, education is a huge part of it, so this is a great opportunity to bring this forward.
So let's start our conversation off. Perhaps you can share with me, what is a concussion, and how do you know if you have one?
Interesting question, actually, because you don't always know that you have one. It's amazing the number of students, athletes, that after the fact they'll say, well, I didn't hit my head, I don't remember hitting my head. And it's not that they don't remember, it's just that it didn't happen. Well, yeah, I got an elbow to the shoulder, or I got stopped by the other player, but I don't think it was a concussion, and yet now they've got symptoms. So, they don't have to know they have a concussion. So what are we looking for? We're looking for those symptoms of loss of consciousness at the very worst, amnesia at the very worst, or not at the very worst, but higher up there, but just fogginess. It's not attending, you think of your great Wayne Gretzky, who could see the whole ice surface, and that was his talent. Often they become honed so that they can't regard multiple things, and that becomes a dangerous situation. Right. So, they can't stand the bright lights, they can't stand the noise. As I said, they're foggy, they're nauseated, they're dizzy. Any one or multiples of those in varying degrees.
Yeah, you can look for any kind of, there's been a jolt to the body. I fell, I tripped, well, serious trip. I got banged from back, maybe checked from the back, or whatever, and I just really had a real sudden movement. That involves the head and the neck. Then you're going to look for that correspondence with these kinds of complaints that she's just described, and that will indicate that you're probably on the road to either a subconcussion or a concussion.
So if you're a parent watching your child play and you see something along that lines, what kind of questions might you ask after the game just to make sure that your child did not suffer?
You can ask them about that specific hit, if they remember it and what happened, how they feel right afterwards, and then how'd you feel if they were continued to play. If there's a knowledge of it, they should really be pulled right away and monitored. If there's a question, or even if you didn't see an incident but you just think Johnny's not playing like he should have, here's the scouts and he couldn't even get the puck to the net or whatever, then you've got to start asking questions. How are you feeling? And going through kind of this kind of list. And again, a lot of the teams have that available to either with their trainer, their coach, or the parents get given that of things that you could ask your child. How do they feel?
And even simple things like, look at me. Try to make that eye contact. Do you have a vacant stare, or are they actually looking at you and responding to you? Do they seem disconnected in some sense in terms of their communication and their coherence of presentation? And something's up here.
Yeah, they're sitting really quiet in the back of the car going home. They don't want to go and eat, where they're always keen to go and grab a bite to eat on the way home. Just changes in behavior, and then you can monitor that. And if in doubt, sit it out, and then going slowly. And if you're not sure, then seek medical attention.
Might maybe just for those that we have a general idea of what a concussion is, maybe just from a physiological, but explaining it so that I can understand it a little bit on what does happen in a concussion, what does happen to the brain that causes trauma, if you will.
I think a lot of people think that a concussion is you hit your head, you get a bruise, and that's it. But the problem with it is you get this dysregulation of the brain. So it's not just that you might have a bruise on the brain, you also have the brain not functioning properly. And that's hidden, and you often don't know about it, and that often persists even after symptoms have settled down. So that's why there's starting to be guidelines, as much as you can make guidelines for concussions, because there's so much we still don't know. So it's really a dysregulation of the functioning of the brain, and maybe
It doesn't have to be necessarily. It doesn't have to be a bleed. It doesn't have to be neural trauma, as in the neuron has been damaged and it's gone. It can be, in fact, the altered state of consciousness typically is that neurometabolic dysregulation that she's referring to, where the neurons are responding to the trauma, and they do so in a way that releases ions to an imbalance that causes what we call an energy crisis in the brain. And because of the required response of the nervous system to kind of put things back in balance, and yet the disrupted blood flow, because you've had some kind of trauma or interruption, you have a mismatch. And therefore, there's this real sluggish response of the brain. And that's the way individuals will describe it. They'll say, I feel slow, I feel foggy, I can't think straight, I might not even be able to look straight, right? It really, their symptoms almost mimic what we see as happening at a physiological level.
So
And it doesn't have to be that you hit your head. You
No.
don't have to have contact with the
No.
board or the ice. It can just be that motion of the head moving forward and backward, and so as you go forward, the brain contacts the front of the skull, which then you get the change of direction. So that in itself is enough to cause injury.
So from a parent thinking, since a lot of focusing on youth, what kind of things would we see in somebody that might have it that would allow us to be able to, because I think most people say, well, if we were knocked out,
Right.
but that doesn't happen.
Absolutely. Right.
What other kind of things, what signs would people look for?
Well, I guess you can talk about symptoms and signs. So symptoms that somebody might have might be, headache, decreased level of consciousness, irritability, trouble seeing, things like that.
Nausea.
Vomiting.
Yeah. They'll complain about foggy thinking. They'll actually use those kinds of words, or cloudy thinking, and which basically just means they can't organize their ideas in a coherent way.
And what would next steps? So if you're starting to recognize that in yourself or others, what would be the next steps for people to do?
It would be get out of that
out of it, yeah.
situation. And that's even if the symptoms are only there for a few seconds. So even if you're on the ice and you kind of go, whoa, and then as you skate to the bench or you go to the bench or whatever sport you're playing, you're feeling great and you're feeling better, the athlete should not play that day.
Because you see now with the National Football League, who has been criticized a little bit in their approach to dealing with head trauma, they now have to go, there's somebody else will come in and bring them, and what kind of tests would they be doing back in the dressing room, if you will, to make sure that this individual may or may not be
Right.
okay to?
Yeah, so they're usually doing a test called the SCAT test. We're now on version 3. There was
Okay.
1, 2, and 3, and that's, I mean, we were talking the other day, it's not the greatest, but it's the best we have right now. So it goes through a checklist of level of consciousness as the basic, but then just, are they foggy? Are they having difficulty thinking? Do they know where they are? Can they remember the play where they got their head injury? So you're looking at amnesia and confusion, photophobia, balance, and then they'll do some basic tests. They'll do some basic balance tests. They'll look at pupils. They'll do it probably, if they can, blood pressure and things like that. So that gives you kind of a baseline. And again, it's not the be-all and end-all, but it's a place to start, and it's also for, say, a trainer who's been trained on a Pee-wee hockey team.
Right.
It gives them the ability for a bit of a checklist and gives them some guidelines.
Okay, so better than the day when I was playing. I said, "What day is it?"
Yeah,
That was
yeah,
about
yeah,
the only
yeah.
question that would be asked
Yeah.
as we went through. So, so once, let's say, people have discovered that there is a challenge, shall we say, what kind of things then would, through the medical community or through your process, would you help people to, if you will, recover?
I guess a lot of it depends on where you are and what system you're in. So if you're in an organized system and this is part of what the school boards and some of the leagues are trying to do, then hopefully you'll go into a process. So you'll have somebody that will follow you along. If it's severe enough, you go to the emerge, and there's now some guidelines for when you should get imaging. And again, people are way over CT'd and MRI'd because it doesn't necessarily make a difference. But there is just that follow-up, and then follow-up either week to week or day to day. And that's kind of where we were talking the other day about the need for education for parents, for emergency room physicians, and for family doctors as to what is return to learn, what is return to play. So appropriate rest and then appropriate challenging, I guess, for that student or that athlete as to getting back into things.
Yeah, because when the symptoms seem to rest and you seem fine, it's when you add extra cognitive effort or physical effort that you push the system too far, and all of a sudden the headache comes back and the dizziness comes back and maybe even the confusion comes back, and it means you're too early. So the first rule of thumb is rest, and the second is as you just challenge yourself. You don't want to push it too far, because actually you push too far and it's as bad as putting you back in the game and causing more damage, to be honest. But if you push and then you hit those symptoms again, you've got to take your time, and it's going to vary across individuals, because it's not just the severity of the injury that dictates what the symptoms will be. It's a whole cluster of variables that you take into the moment of the concussion. What was the force, what was the impact, what was the angle, what's your body size, what did you eat that day, so on and so forth, right?
So, because when you really look at how long then does it take to heal from a concussion, it depends.
Right, exactly.
It depends.
I mean, the shortest you're going to look at, and kids find this really difficult, and parents find it difficult, and coaches, is if you've got somebody that, say, takes a day, symptoms resolved. It's going to be, or it should be, at least a week until they're back playing a game, and that's if everything progresses as it should. So it's not like you're going to go back and you're going to skate and then 2 days later you're back playing. You're going to go and skate on your own or lightly jog. And in pediatrics, we use a 2-day rule. So if they can do that for 2 days, then they can go on and increase that and get their heart rate up a little bit, therefore get more brain or more flow to the brain and see whether you reproduce symptoms. And then after that, they may be doing some drills. And then after that, they may be doing some light work with others. And it's not until an athlete can do a full practice, that's like a scrimmage, a full scrimmage, that they should be allowed to go back into a game.
And the same with the classroom. So you bring them back into the classroom, you're not going to be expecting them, you should not be expecting them to be performing. Can they stay in the environment? Is it too stimulating, or are they able to concentrate? Are they able to now start to produce or to participate? Do they seem to be comprehending what the teacher is saying to them in terms of instruction? And that needs to be a gradual return to learn in the same way it's a gradual return to play.
And we also talk about that time when they're resting at home. Ridley, we take their phones away from them and we take their laptops away from them, because that bombardment of texting back and forth and watching that crazy movie or doing video games is one of the worst things they can do.
Huge cognitive demands, right? You've got a lot of interaction with another individual, a lot of interpretation of what's going on, and it's very visually stimulating.
Yeah.
And visual stimulation can be one of the triggers for
One of the worst concussions I ever had was a gal who was doing very well on her, she had a significant concussion, she was doing very well, went home for Christmas, and parents took her to Disney World. And she came back and she was worse than square one.
Yeah.
Because it was a great time, but not good for a concussion.
Yeah, very similar. I had a young woman. She was in her early 20s, but had a history of actually repeated concussions, unfortunately, in basketball sports. And her friends, she wanted to be part of things. She was trying to get back up and running and going and doing things. And she went to a concert, and it was the worst evening of her life. She had to leave. And yet they were doing it for fun. Like it looked like it was recreational. It is, but it's also very cognitively overstimulating.
So when you mention about multiple concussions, are people more susceptible after they've had one concussion to have further?
Absolutely. Just statistically that happens. And the impact of those repeated concussions, depending on how soon they come together, what the duration is between concussions, can have serious impact. So if you have two very close together, that's much worse than having two far apart, which is much worse than having one.
Right, that's right. Yeah, and the fact is, when they're closer together, they're less likely for all those things that we don't know enough about yet, and we're looking at you for that, to have that ongoing so that they haven't completely healed, and therefore they're going to be just more at risk for another concussion is the big thing, and then also to have more long-term sequelae from it.
Are there, I'm just thinking of my coaching days, and something happened when a player would come over and talk to you, and you didn't think anything happened, or what would be a sign that you should really have a closer look with or talk with that individual?
That's a really good question, because there's even a research area called looking at the subconcussions. Though those are concussions that are they're consequences of having a force against the body or some kind of jolt to the body, but it doesn't mean the head impact. You'd said we don't have to hit our heads, and you don't. But those are much more subtle, right? If I get hit in the shoulder, or if I bump into something, or if I get jerked in terms of what looks like simply whiplash, those can have incredible impacts. So you're right, a lot of people won't even notice those. So what do you look for? What do you look for in terms of the behavior?
Yeah, I think a lot of that is if there's any concern, then they should be pulled and watched and monitored. A lot of the times I'll see them like 3 or 4 days later when they continued to play in the tournament because they hadn't hit their head. They were fine by the time they got to the bench, and by golly, we had our championship game coming up. And then a lot of the times they end up getting pulled from the championship game because they're just not playing right if there's somebody astute, or by the next day they're having terribly significant symptoms, and then they realize, my goodness, I was playing concussed. And there's a lot more acknowledgement of that now, and I think a lot more awareness of it. But it's that matter of being able to say no by the coach, by the trainer, the athlete, or the parents.
Yeah, that vulnerability is big for those repeated injuries because of that, right? Especially in sports, but in everyday life, if the student is at all competitive, or if the family is all competitive, or the coach is all competitive, there's going to be a will to, I don't feel any symptoms right now. I do feel better. I want to get out there and get going again, right? That's who they are. That's their motivation. We don't have the bullet yet that can actually identify this is the indicator. This is what tells you where you are on the scale of concussion and return to play or return to learn.
We can't do a CT or an MRI and be able to say you have a concussion or you don't, because it really adds nothing. CT scan is better than an MRI. The MRI's role is really only if you have ongoing symptomatology, so seizures and things like that, where you need to look at the function of the brain. CT scans really are reserved for somebody with persistent vomiting, decreased level of consciousness more than 2 hours, for a high impact, so an MVA with head injury, a fall from more than 3 feet or down a flight of stairs. Over 65-year-olds as well usually end up getting a CT. So it really, I'm shocked at the number of people that come to me that have been the gamut of testing because somebody told them to, or a friend that was in the medical field said, You need to get a CT or an MRI, and it happens, and it doesn't add anything. So there's certain criteria now that we follow for doing a CT scan, and more often than not, it's not needed. It's not going to add to what
It's
we're
not going to
doing.
add anything, and it may misinform.
That's
Right? If you
right.
have a CT, if it's a metabolic problem, that's not going to show up in a CT, right?
Right.
A bleed will, encephalitis will, but a swelling will, but your neurometabolic processes, those are just the neurons not doing what they're able to do and do it well. So you come away and you say, oh, okay, your CT was negative, you're fine.
And
Yes.
that's the big problem.
And that's
Yeah,
the problem,
that's the big problem.
right?
Yeah.
You've been now, you've attributed the wrong conclusion.
Mm-hmm.
It doesn't mean you're fine. It means you're not catastrophic or severely
right.
injured.
That's right.
Great.
Yeah, you don't have a depressed skull fracture.
Exactly.
That kind of thing.
Yeah.
When I look at back in my athletic therapy kind of days, that it would be rice, rest, ice, compression, elevation would be the natural thing for trauma to the body part. What would be? Is there a similar type of thing? Is it just go see the experts? So would you first thing go to emerge? Or go to see your physician. What's the best thing to do?
I don't think everybody needs to go to Emerge.
Right.
I think there's a group that feels that everybody should go to Emerge, but they're not necessarily going to help you. So certainly if somebody has significant neck injury, you're going to call 911
Right.
and they're going to be boarded and off they go. But again, kind of the same protocols for CT. If you've got somebody that's got amnesia greater than 30 minutes before the event, so they can't remember their game they played at 2 this
Right.
afternoon and it's now 6. If they can't remember the beginning of this game, then yes, they need to go. If there's a thought that they might have a depressed or open skull fracture,
Right.
if they've got fluid coming from ears and nose
Yeah.
or pupils that are unequal, vomiting that's persisting. Oftentimes they'll vomit once or twice after just because of the head injury and
The dizziness.
and everything. But if that vomiting is persisting or their whole persona has changed significantly, then and it's not resolving or things are getting worse, then they need to go to the Emerge.
They're staggering and they can't hold their balance at all. If that doesn't recover, because it will, these are more serious indications, right? But even at that point, the headaches and the dizziness, a lot of those still might not indicate emergency, but certainly a call to your family doctor.
So when you take your youngster home, quiet, rest, though, dark rooms, those best sorts of things, definitely take away their
Rest
Rest.
is number one.
And it's awful because they're bored.
Yeah.
They're bored and they're complaining and they want to text their friends and they want to, watch their laptop or the TV or whatever. So I always say, once a few days things are settling, and I'll say, why don't you watch like an old romance movie? Oh, really? Are you kidding? I'm saying, well, it's better than nothing.
Yes.
Nothing, no Superman, no action, Magnificent Seven. It's just going to be low-key stuff
Yeah.
if it doesn't reproduce your symptoms.
Right.
And then the big challenge also is for them not to get their days and nights mixed up because they're lying around all day and they're tired. They're often phenomenally fatigued. And then they're not sleeping at night and they're sleeping during the day, and it can be a real struggle. And that's where sometimes or often just giving them feedback, seeing them and following them and normalizing things.
Normalizing their sleep, normalizing their diet intake, trying to get all of the systems back in rhythm.
Right. And usually most concussions resolve within about 14 to 21 days, if not sooner. And there's a few that we have flags on, if we have patients or athletes that have a history of depression, anxiety, mental health disorders makes things worse. History of ADHD or ADD will sometimes prolong things as well. So you have to look at all the different kind of health and past history as well can come into it.
And those same symptoms can emerge after the concussion. So you really need to know your person. Of course, as a family member, you do. If it's a family doctor, they often do. And they can do that sort of contrast because you can have depression symptoms, anxiety symptoms, and ADD and ADHD symptoms all emerge as a function of having disrupted the brain.
Looking a little bit at the policies, because I know we talked a little bit that many organizations are moving in that direction, but or the schools are, and if you're perhaps our listeners are thinking about their sports organizations and the like of that, what kind of things could they develop good policies to help their organizations deal with this?
Right. Well, I mean, there's lots of educational resources they can go to
Yeah.
now. Certainly a lot of the policies, I went online last night and you can actually look at policies for different school boards. In fact, I printed one out. So there's a lot of information available. Public health, Niagara Region Public Health is really involved in helping organizations develop those policies, which is great. You can go online. There's a lot of information through some of the brain trauma associations and like Think First and a lot of different organizations that are there to be a free resource to organizations. Hockey Canada's been involved. Some of the other sporting organizations have been involved in creating educational tools that you can take to your organization. So you don't have to recreate the wheel. It's all there. It's a matter of putting it together and then I think making it work for your organization.
And one of the leaders, I'd say, is actually DSBN right here in our own area. They host a annual concussion summit. Their fourth one's coming up in April 2016. And they've been really aggressive at recognizing the frequency of concussion within their school world. And also with the interest of what can we do about it? What can we do about it better? How can we understand it better? And they literally bring in a number of individuals to give short talks on immediate sort of impact. Here, you try this, you can do this, and this is what the research is telling us. And then they bring in world-renowned scholars to give keynote addresses so that we can, as a region, but also inviting our neighbors to become more informed and develop better policy.
So when we're looking at a policy, what types of things would be included in a formal policy?
I think basically I think it has to include an education component. So I think the first part of the policy and most of the policies that you look at basically go over what is a concussion, what constitutes a concussion, what are the signs and symptoms of a concussion. And then it talks about their local policy for pulling students from play. And I know locally now the students come to their family doctor with a piece of paper that basically says they've had a concussion and that we have to give the return to play. And so I think that that's where the whole educational component has to come into it. So again, I talked earlier about for the athlete, for the parent, for the coaches, and then as well for our medical community to make sure that we're all up to snuff on that return to play, because it's easy for us to say, have you had any symptoms all week? Okay, great, you're good to go. That's not adequate. So I spend the time talking to them about what have you done, and then this is what you're going to do for the next 2 days. If this happens, do this. If this happens, go back. And then see them within a few days and go over that again and again. And only then will I sign off that they're okay to return to play. That's not happening all the time because, as I said, they just say, oh, you're good. Okay, fine. Oh, you had an MRI and it was good. Here you go. And I'm not saying that's across the board, but I think that's where the whole education component from the emergency department docs down to family physicians to the to our nurse practitioners down to the parents, the coaches, the teachers. Everybody throughout the system has to be on the same boat, and that's where this helps to delineate.
What's
that.
really important about that is you got to underline communication. One of the things that I think is first and foremost is bring it to the attention that there's been a concussion. We did a study supported by the Ontario Neurotrauma Foundation that was province-wide, and when I say we, a number of my colleagues and myself, and we were looking at catastrophic injuries, so very serious brain injury and return to the school environment and school reintegration. One of the things that was, in addition to the interesting ideas and results that we obtained, one of the things that was shocking was in going through the ethics requirements. You get you have to have the hospital ethics covered, the university ethics covered, the the family consent, but we also have to do the school boards. And when we'd approach the school boards, great, we'd do the ethics requirements, and then they would give us permission to then contact the school where one of our kids is from, right? And we'd say, we'd like to work with you, and we want to work with teachers, and we want to look with principals as well as the student. And they'd say, we'd really like to participate, but we don't have anyone here with a brain injury. And I've got my list that said, right? So that's a brain injury.
Yeah.
What we were finding is families weren't communicating that to the school, or there was a lack of communication because it wasn't just family driven. It was, it takes two to really coordinate that information. So I think the big thing about the DSBN policies and other school policies is it opens that communication. You know, even if you don't know, you bring it to the school's attention. My child has a concussion, or a teacher will get back to the family and say, your child, you know, got knocked pretty hard on the school grounds today. They may have a concussion, or they did have a concussion, and it starts the discussion.
Right.
And then we can watch, and then we can look.
Right, and you also have to have communication between their sports team or, you know, their gymnastics club where
Yes.
they've had their knock, and the school, because I've had kids that I've pulled off because of their sport, but then I found out they were at a basketball tournament for their school all day.
Yeah, yeah.
You know, and it's like,
Or right back into the
because they're back
classroom to
see
write a
me
test.
because they're having symptoms again.
Yeah.
It's, well, yeah, we've been following him. He's not playing travel, but he had a basketball tournament at school and they needed him. It's like, so that's again where the education comes in.
So this has been another episode of Consider This, a partnership between Brock University and Niagara Connects. I'm Barry Wright, and I'm the director of the Niagara Community Observatory. And today I've been speaking with Dr. Don Good, associate professor here in the psychology department at Brock University. Dr. Kathy Swayze is a medical doctor and a fellow at the College of Family Physicians of Canada, and she's an assistant clinical professor in the family medical department at McMaster University. So thank you both for joining us today. Check out this and other podcasts on the Brock News and Research at Brock websites, and thank you for joining us today.